I'm an educator, as you know, and I have many colleagues that are really living in dread fear of going back to school. Young, healthy educators, and of course there are, just like everybody, educators, we run the mix in age and health. But what would you say to educators that are just really so fearful of returning back to school? I had a colleague actually send a message out this morning that said, I'm not a hero. I'm not a hero. I don't want to be a hero. I want to be alive, and I want my students to be alive. So people are really afraid, and I would say, what's your advice?
Many of us are at extremely low risk of a severe outcome even if we get COVID. I actually used a risk calculator that colleagues at a company called Everest Health developed. People can learn more about that. They go to everesthealth.com. But I entered in personal data, and it tells me, okay, here's your actual age. My actual age is 57. But I'm a preventive medicine specialist. I exercise daily, I eat optimally, I never smoked, I try to sleep enough, I try to manage my stress, all the good stuff. So my COVID age was 42 because of my health. I have no chronic health problems, and I'm at very low risk. The risk to a healthy person in their early 40s is very low. I really wasn't concerned. So I took precautions. I had an N95 mask and all of that. Working in an emergency department, but I wasn't afraid. I thought, I'll take reasonable precautions. If I get this, I think I'll be fine. And there's a reasonable chance I won't get it if I take those precautions. So, I think that perspective now has to be shared. So maybe one of the things we need to do here in Connecticut is make risk quantification available to everybody. Maybe teachers should have that option. So tools like this risk calculator should be made available statewide. What is your personal risk if you were to get COVID? So you're a teacher, you go back to school based on your age and your health status. If you were to get exposed via the kids, what's the likelihood that you would be sick enough to be hospitalized? And it would generally be a very, very small number, very small.
Right.
So it's 99% probable that if you got this, it'd be like the flu or maybe even milder. There was a study that came out in JAMA Internal Medicine looking at antibody testing at sites around the country. You may have seen this. What they reported is at least 10 times more people in the United States have had COVID than we've documented. I've been saying that all along.
Right.
It was perfectly obvious based on the percent of people who get this infection who die in other countries, that if 150,000 people had died in the United States of this infection, that we were much closer to 40 million of us having had it than 4 million. So we're reporting 4 million. It's much more like 40 million, maybe even higher. Well,
which is good news.
It's
very
good.
Good
It's
news.
exactly.
Right.
I mean, that's reported as, more people have it, that's bad. No, these are people who have had it, got over it. Most of them never knew they had it because they had no symptoms at all. That's good news. It means almost all the time, this is a mild infection. We're hearing about the severe cases. And actually, so to these colleagues, and thank you for being an educator, it's such an important mission in life. And all of us who go on and try to make contributions, part of that credit goes to people who educated us, so thank you, it's so important. But here's an analogy to share with people who are nervous and afraid. Epidemics, outbreaks, pandemics are like icebergs. There's the small part that's highly visible, and then there is most of it which is hidden from view. Well, what's the small part that's highly visible? It's people who get severely sick. If somebody needs a hospital bed, they're hard to overlook. If somebody needs the ICU or a ventilator, they're impossible to overlook. And if someone dies of an infectious disease, we tend to notice. If somebody says, I don't feel so great today, I've got a slight headache, I'm a little achy, I think it's nothing, and it goes away in 3 days and they never tell anybody, that's easy to overlook. If someone has no symptoms at all, that's even easier to overlook. Well, that's the bulk of most outbreaks. You have to go looking for those cases. You don't find them unless you go looking for them, because people with no symptoms don't report to their doctors, don't report to hospitals. We're finding that, wait a minute, 10 times more of us have had this than we realized. Okay, so the 36 million cases that we knew nothing about, they weren't severe. If they were severe, we'd know about them. They were all relatively mild.
This should be a celebration.
Exactly.
We should be celebrating.
Exactly. So whatever you thought your risk of a bad outcome from COVID might be, it just went down by a factor of 10. you're 10 times less likely to get hospitalized, 10 times less likely to need the ICU, 10 times less likely to die, and those numbers then suddenly get very, very small. So 150,000 deaths out of 4 million people, we're talking about a mortality rate that's up around 4%. If it's 150,000 deaths out of 40 million people, we're talking about a fatality rate that's a fraction of a percent. So you're 99.6% probable, even if you get this, to get through it and be okay. But there's also a high probability that you don't need to get it in the first place. And that's the other thing we need to do to address these concerns. If we're sending the kids back to school, certainly if there are teachers or administrators who are older or who have chronic illness, I think we need to have waivers available.
Well, I
for
love
them.
the idea of the risk calculator that you were mentioning.
Yeah, so I think people should know their risk
Yeah.
and should be empowered to manage
Where can
their
we
risk.
find that?
Well, again, we've been working with colleagues at the company's called Everest Health. I've seen a number of tools online, but this is the one I'm directly involved in and I like the best. everesthealth.com, and you and I can make sure you get that information.
Absolutely.
So wherever
I'm
these
gonna
videos
plug
go,
in my
you can post
information.
it. Yeah. So,
and see what my COVID risk is.
I found it very illuminating for me. It was very reassuring for my family because I said, look, I think I'm at low risk. I know I'm 57. Being above 50 puts me at slightly higher risk. For some people who have serious chronic illnesses, their risk will be higher. So again, I think we should measure risk. I think we should empower people to deal with risk. One of the things we ought to do is if you've got risk factors related to your weight, related to your blood pressure, related to your blood sugar, I think we should then provide people guidance. Let's do something about that.
Right.
Let's talk about tools. This is what I do most of the time, by the way. I focus on nutrition. I run a company called Diet ID where we help people improve their diets. So let's take advantage of this opportunity to immediately reduce your risk of a bad outcome if you happen to run into this bug. And oh, by the way, improve your health for the long term.
Right.
Anyway, right? It's vitality is a good thing. That's the gift that keeps on giving. You don't need a pandemic for vitality to be a good thing. But during the pandemic, you can begin to reduce your risk for a bad COVID outcome with a single meal. A single meal alters blood flow, alters immune system responses. A single walk, really just going for a walk today, actually already starts to alter your hormonal balance, your immune system responses. So yes, people should know their risk. Let's help them do that. People should be empowered to address their risk. But I do think we should have waivers for people who have clear risk factors for bad COVID outcomes, and they should be supported. They should have opportunities to contribute. I mean, there are ways we can work this out.
Well, I can tell you, I've been on the reopening committee for the district where I work, and there already are carve-outs. So there are carve-outs for people to opt into distance learning if they have risk factors. So the distance learning option is there, but the people that are getting ready to go back, they have concerns about the virus.
And so again, I agree with you, Ellie. So again, the virus that causes this infection deserves respect, but our fear of it is out of proportion to the threat. So again, 10 times as many people in this country, it seems, and I personally think the number is even higher than that. But based on the best available recent data, 10 times as many of us have been through this already, as we've documented, and the overwhelming majority had symptoms too mild to even seek any medical attention or no symptoms at all. That's extremely reassuring.
This is Kousidis, and I approve this message.